I work with individuals who are incarcerated and have mental illness, which is kind of a statewide, a nationwide issue actually. And we just kind of are developing this program in the past couple of months to try to connect them to mental health services in the community, as opposed to simply incarcerating them. Some of the issues that I notice is kind of a lack of streamlining and a lack of communication with certain organizations, and we're working towards developing some initiatives here in town to combat that problem. We have our local recovery-oriented systems of care, which has just begun in the past couple of years. We call ours Bridge to Recovery. It's a Department of State Health Services sponsored organization where we're trying to bring together local resources like our MHMR services, Alcohol and Drug Abuse Council, Concho Valley Turning Point, Esperanza Health and Dental, and we're all just kind of trying to figure out how to streamline those. But it's still a problem that we're addressing. We're still working on our collaboration, trying to figure out how to do kind of like a collaborative intake process there. One issue, for example, we're having problems with state hospital bed availability because we have a lot of individuals who are in jail who have to go there for competency to stand trial. They have to regain competency. It takes up a lot of room, takes away from the ability to commit people civilly from the community who need that level of care. And so it filters down. There's a domino effect where you have individuals who get hung up in the emergency rooms, for example, or in the jail, or what have you, in a lower level of care than they need to be. And so it's kind of that domino effect there. And we don't really have any satellite offices, and so what you have are folks who live in, say, Ozona or Robert Lee, who don't have a lot of resources themselves, kind of having to drive into town to our clinics. We serve 7 counties. Right now my program is just kind of focusing on Tom Green, and then we hope to expand that out once we develop what we're doing here. But MHMR as a whole does serve 7 counties, and we try to do as much rural outreach as we can, given our resources. Those are some health issues that I deal with kind of in the mental health realm every day. I mean, everybody knows that San Angelo is kind of in a more politically conservative part of the world, but we actually have a lot of very passionate people about the human services. We have, for example, in the mental health field, we have a lot of collaboration from local judges, mental health deputies, the sheriff's office, police department. We gather around in meetings of several different coalitions designed to address homelessness, jail diversion, and the response has been overwhelmingly good. Also, our private psychiatric hospitals like Shannon Behavioral Health, Rivercrest Hospital, all of them really, they come to the table whenever we have discussions about even just jail diversion, keeping people out of the emergency room and the jail. They like to come to the table and talk about that and collaborate on ideas. And so in the years that I've worked in this profession, we're pretty lucky. I think it is. I think that it's quite a long distance, a long drive. It's easy for both of us to kind of forget about each other in kind of our isolated parts of the world. I could see how that could be a barrier. Communication is very important. Anything to improve collaboration there, this is good. Well, San Angelo has a bit of a reputation. We have a 4-year state university here, which trains a lot of licensed professionals, licensed professional counselors, social workers, nursing staff, and we're kind of notorious because we're a smaller town of about 100,000 people for educating and training individuals here, and then they move elsewhere to larger cities for more opportunities. That's certainly a major gap that we face. Having the training center, having more CEUs available for these individuals, I think that engaging them at the university level would help quite a bit, kind of introducing them and their families to San Angelo, showing them what a nice town it actually is. Like it's actually a pretty good town for 100,000 folks. I had the thought of maybe hosting more conferences here, just to kind of attract people to, because just just driving around a town when you get there for a conference, and seeing kind of what the town has to offer when you go out to lunch or something like that, you can be like, this is a really nice town. So it might help with recruiting. As an LPC intern myself, working on his full licensure for licensed professional counselor, I'd like to see more CEUs dedicated to working with some of the growing populations that we have here locally and statewide, like veterans. We also have co-occurring psychiatric and substance abuse disorders, and also the LGBT community. I think that CEUs targeted towards those growing groups, those growing populations with growing needs would be really, really good. Some real solid bilingual education for healthcare professionals would be really good too. Yeah, it's a growing population that need for bilingual education and to be bilingual in what we do. You hit a lot of roadblocks here locally, I've noticed, where you don't have trained staff, certified staff who can do like interpretation and things like that. I don't know if it's being missed. I don't know what they really have in place. I know that we've gone out and spoken to high school students at Central and Lakeview, but more could never hurt. Preaching healthy lifestyles, we can't do that enough. And also where to seek help when you need it. Many programs designed to target that group, I think, are good.